Hi and a very good morning to all of you. Today we are going to start with a new subject which is community dentistry. Now one of the driest subject people consider for NEET MDS examination, but now see, it depends upon how much determined you are, how much interested you are. Okay, if you're interested to learn community dentistry, or more than that, if you're interested to learn the concepts in community dentistry for your MDS entrance examination, it's not a big problem. If you start reading your textbook, whether it's Park and Park or your Soben Peter, whatever, if you start reading your textbook, it becomes a big problem. So just listen to this. Okay, listen to these lectures, take down your notes. Wherever notes are available, PDF notes are available, go through it, solve your dental pulse, done. Okay, don't worry about anything else. If you start going into depth of community dentistry, it's a big problem. Now see, you know that you can't go to the depth of community dentistry because you don't have, it's not one subject for you, isn't it? There are 20 subjects. So this is enough. Okay, now, considering the community dentistry, the most important chapters are epidemiology, biostatistics, fluorides. Okay, epidemiology, biostatistics and fluorides. You have to be very thorough with this. A little bit of indices and all other overall, what is there in your dental pulse will be sufficient. Okay, so the first chapter we are going to start is about public health. That is what is community dentistry or community medicine. Okay, or community health, I would say. So earlier it was public health, now it is community health. Okay, so how all these concepts emerge, how did all these concepts start and emerge? That is what we are going to see today. Okay, now one thing which will astonish you right away is father of public health. It's not a person, it's cholera. Now why? Because it was this disease when cholera emerged, or when the people were affected by cholera, then only people or the scientists realized that now see, individual health is one concern, but public health is another concern. Entire community can get affected. It's not that one individual, two individuals, 10 individuals, an entire community can get affected. So you have to look into something which can solve this problem. That's what comes the father of public health. Okay, now this is another thing. Okay, changing concepts of public health. How did all these concepts change or evolve? That's what we're going to see. So in 1880, I'll tell you how to learn these dates. Okay, in 1880 or from 1880 to 1920, what was the concept? The concept was disease control phase. Okay, controlling the disease, whatever is there. Okay, then from 1920 to 1960, there came the health promotional phase. Okay, it's not just controlling, you have to promote health. Okay, besides controlling your health, you have to promote a good health. Okay, tell the people about good health. Just understand it this way, I'll explain it to you. Now, 1960 to 1980, it's social engineering phase. Now, technology comes into play. Disease pattern changed and technology came into play. Chronic disease, okay, it was not just infections, chronic diseases like diabetes, hypertension, all these evolved. So social engineering, okay, social environment was considered, social behavior was considered, and technology was put into use. Okay, then from 1981 to 2000, there was a health for all phase, and from then it is just health for all. Okay, it's health for all phase. 1981 to 2000, it's the health for all phase. Okay, so now how to remember this order? This 40, that is 1980 plus 40 is how much? 1920. Okay, so remember the first date, 1880. Okay, to 1920, 40. Then to 1920 add 40 again, it's 1960. Okay, then add 20, that is 1980. Then add 20 again. Okay, so that is 40, 40, 20, 20. If you just remember 1880 somehow, end product is 20. Or you can go back. Easier date to remember is back, right? 2000. So 20, 20, 40, 40. So just minus. Whatever is your comfort, do it that way. Okay, so it was controlling the disease initially, then promoting it, then came the technology, and then we realized that okay, it's not just some people are getting, initially the developed countries were benefited from this public health. Now it is like health for all. Okay, so we'll come to this one by one. So the first thing, that is 1880 to 1920, disease control phase. What was it? I'll just give you a broad understanding of this. Okay, some things are important. So controlling man's physical environment, so the environment around us where infection, okay, the sanitation, the drinking water, everything was causing the disease. Okay, that is water supply, sewage disposal, everything was controlled. Okay, so that was considered. Then came the health promotional phase. Now here, promoting health of the individual, not just controlling disease, promoting, okay, informing the individuals about the promoting health of the individual. Okay, now besides promoting health of the individual, one more responsibility was considered, that is state. Okay, it was considered that the state or the country had the responsibility for the health of the individual. It is not just individual, okay, who's taking care of his disease, or just community. The entire state had the responsibility. Okay, so state has responsibility for health of the individual was the outcome of health promotional phase. Okay, now after that, so what comes under that? State has a responsibility. You could see that the mother and child health care services came into being, and school health services was also considered. Okay, so state said that, okay, now we could take care of the mother's health, the child's health, the school going children's health. So all these things came into being after that. Okay, you go into medical colleges, you see that there is a special department for maternal and child health. All is outcome of, okay, long-term outcome of all these. So it was the health promotional phase. Now, what is next? Social engineering. Now, why that? Acute illness initially then gave rise to chronic illness like diabetes mellitus, hypertension, then coronary artery disease, all these. So based on these, there came a concept called risk factors. Till now, infectious diseases, there was like microbes and all those. There was nothing like, risk factor concept. Okay, there was an infectious agent which it affects the person, and they thought that, okay, this is it, that this caused disease. Now, when it came, the diabetes mellitus, for example, the risk factor is taking too much of sugar, okay, or lack of exercise. So all this gave rise to the concept of risk factors. Okay, concept of risk factors. So now, based on this, it came the understanding that social and behavioral aspects of disease, behaviors, lack of exercise, smoking, so all these behaviors came or was given more importance. Okay, so then the concept of public health got converted to community health. That's what I said. Okay, then that is the prevention and rehabilitation of chronic diseases was given priority. Okay, the public health emerged into community health, and then they said, okay, prevention of chronic diseases and rehabilitation of those persons who are affected by chronic diseases was given the priority. Okay, then finally health for all phase. Now, very simple. It's like very high contrast in provision of health in developed countries and developing countries. Okay, then they said, okay, this is unacceptable. We should provide health for all. Now, based on this health for all concept, remember this. Okay, remember this. This is the most important point you have to study here. The primary health care system came into being. Okay, every state, every city, every region, every village has got something known as primary healthcare system, so that health for all is being provided. Okay, so the primary healthcare is the outcome of health for all phase. We're going to go into details of the primary healthcare a little bit. Okay, so basically there are 4 phases, initially starting with disease control, then health promotion, social engineering, followed by health for all, 40-40, 20-20. Okay. So majorly it's all the same thing, okay, simple. Then the concept of risk factors emerged as a result of social engineering phase, then public health and all those, that's it. Okay. Now, so we said based on the health for all phase by 2000, so it's all over, huh? 2000 is over, but yes, new concepts came emerging then. So they said the primary health care primary health care system has to be considered. So what exactly, where exactly was, or when exactly was it accepted? What happened was, by WHO UNICEF International Conference, which was held in 1978, okay, at Alma Ata. Okay, now this comes the Alma Ata Declaration, if you have seen this. So Alma Ata is a place in USSR, the old Russia, okay. In USSR, at Alma Ata, they considered that we should be giving priority to the primary health care. Okay, and it was accepted by 134 countries at that time, who was a member of WHO and United Nations. Okay, so they came the concept of primary health care, and this is related to Alma Ata Declaration. Okay, if you are reading from your MCQ books, you will not get this connection. You learn Alma Ata Declaration, you learn primary health care, you learn the concepts of emerging concepts like health for all, but this is connected. Okay, now one more thing. In 1978, okay, it is in the 1978 where the Alma Ata Declaration came into being. But see this. It's 1981 to 2000 is what the health for all phase. Now, so that means initially it was the Alma Ata Declaration and primary healthcare system which was emerged. Okay, so this came into being, and later on only it was accepted, okay, by the authorities that primary healthcare system has to be considered. Okay, don't confuse there. Okay, it's in 1978 where Alma Ata Declaration and the concept of primary healthcare came into being. In 1981 to 2000 is where the concept of primary healthcare was accepted by the authorities. That is very important to understand here. Okay. So that is the Alma Ata Declaration by 134 countries in 1978. So we're going to go with the Alma Ata Declaration and primary health care together. Okay, whether they ask about primary health care or Alma Ata Declaration, is the same chart which you have to learn. Okay, so now let's come on to that. You have got hallmarks of primary health care. So it's hallmarks. Okay, hallmarks of primary health care. Then you have got pillars or principles of primary health care. So hallmarks, pillars or principles, and finally elements. Okay, so three things you have to learn here: hallmarks, pillars or principles, and elements. So let us go one by one. Okay, so the hallmarks, there are 4 A's. Simple way, 4 A's. So starting with affordability. It should be affordable for all. That's a one hallmark of primary health care. Primary health care should be affordable for all. It should be cheap and it should be affordable, isn't it? Then accessible. It is not in a very remote area where people can't reach. It should not be on top of a hill. Okay, in a village on top of a hill. No, it should be accessible easily. Then acceptable. Now, if you go on to very remote areas, especially in the northern regions and the eastern regions of the country, you will see that there is lots of religious practices which people think that I shouldn't go to. I don't know how much is there still. Maybe probably it's all improved, but yes, people are not ready to face other groups of people, are not doesn't want to go to doctors and all those. So it should be acceptable. Okay, system should be the acceptable. That so it should be region wise. It should be arranged. That's what acceptable. That's the next A. And finally, availability of the staff. Now there is a beautiful clinic being put there. Okay, and there is no availability of doctors and nurses and all those. It should not happen. Okay, so availability is a very, very, very important thing. Now, when it comes to pillars, so that was the hallmarks: affordability, accessibility, acceptability. Now, see, you don't need to learn this for your entrance examination. It's there in your options. They will ask you there. So 4 A's are there. You understand this, what is involved, and the exceptions, you will be able to easily get it out. Okay. Now, pillars of or principles, you should remember a short form called ECIA. It's easy. Okay, remember it like it's easy. Okay, or you can remember it as that age of ice. Okay, so it's going back. Okay, age of ice or ice age, So age of ice. Age of ice. Now let's see what are the components or what are the pillars or principles. The first thing is equitable distribution. It should be distributed equally. It is not that in a particular region lots of clinics are there and another region there is no clinics at all or no primary healthcare system at all. So it should be equitably distributed. Then there should be a community participation. It is not that government, central government or the state government comes and just sets a clinic and no one is involved. It should be every sector of the community. Okay, higher authorities, lower authorities, everyone should be participation. So it's a community participation which is very, very important. Then intersectorial coordination. Again, a part of community participation, that is different sectors of government should be coordinating things out. It should not be left to the people around. Okay, intersectorial coordination is important. Then appropriate technology. It's not like, the barbaric age technology should not be used. What is the recent technologies? That's what. Appropriate technology is a very, very, very important thing. Okay. So equitable distribution. So easy. ECIA, community participation, intersectorial coordination and appropriate technology. Very, very simple. Now, coming on to the last part, the elements. So what we studied? We studied hallmarks, pillars or principles, and finally the elements of primary healthcare. Now, in elements of primary healthcare, you have to learn a short form elements. Okay, you have to learn the short form elements itself. Okay, so it's easy now. First is all A, then AGIs or easy IA elements. Okay, so what all comes under the elements of primary healthcare? One is education regarding the health problem. Is education. The people should be educated about the health problems. Okay, in primary healthcare. Then locally endemic disease should be taken care of. So it will be different for different communities, isn't it? The endemic diseases are different for different communities. So locally endemic disease should be taken care of. Then essential drugs should be provided for that particular disease or things. Okay, so essential drugs has to be provided. Then M is for maternal and child health care should be taken care of. M is maternal and child health. So you just remember the short form. Then E is for expanded program of immunization. Okay, E is for expanded program of immunizations. Then nutrition, and then you have got treatment of common diseases. So you have to take care of the endemic diseases as well as the common diseases of that community. Okay, then safe water, S for safe water. So how you can group this into? Basically education, everything comes under education. Okay, and then three things are very much connected. What are they? Endemic diseases, endemic diseases, then you have got common diseases. Endemic disease and common diseases and drugs for that. Isn't it related? Endemic disease, common disease and drugs or essential drugs, I would say. Then after that, these two are related. Maternal and child health and immunization. Related, isn't it? Then finally, when you have all these things, you have to provide good nutrition and safe water. If you remember it like this, it's easy. Okay, so we studied A, hallmarks. We studied pillars and principles. ECIA, equitable distribution, community participation, intersectorial coordination, and appropriate technology. Okay, then you have got elements. Okay, where you just educate, then disease and drugs, then maternal child immunization, and finally the nutrition and safe water. Now the short form elements is not by me, it is acceptable short form for this. Okay, it is a short form which is, so you have to learn these orders. The order is important here. Now let us understand the levels of healthcare. We studied primary healthcare system, Alma Ata declaration. Now we know that there is a primary healthcare system, but there is more levels now. It's not just primary healthcare, there are more levels. Okay, there are basically 3 levels now. It's not just, it's all started with primary, then now we have got more. So 3 levels, and based on this, the referrals from the base level to the highest level takes place. Okay, when you listen to this, you'll understand this very clearly. The primary healthcare, now this is an MCQ, the first level of contact between individual and health system, a person, a diseased person and health system, or even a normal person and health system, the first level of contact takes place here, primary healthcare system. Okay, and it's a health system which is closest to the people. Okay, so these are 2 questions you can expect. It includes primary healthcare centers, easy, primary healthcare centers and sub-centers. So who are sitting there? I'll tell you later on. So it's primary health centers and sub-centers. Then comes the secondary healthcare where more complex problems. So in primary healthcare, the base problems, okay, the fever, all those simple things. Then secondary healthcare, the more complex problems are dealt with. Now here the services provided by the district hospitals and community health centers, CHCs. Okay, so it was primarily PHCs, then it is CHCs and district hospitals. Okay, district hospitals and the community health centers. Okay, then comes tertiary healthcare where super specialist care is provided. But besides the super specialist care, what they also do is planning different things, planning different projects. For example, the oral cancer projects or monitoring of oral cancer and all those. So that's planning plus teaching. So now you know where it is actually, the medical colleges. Okay, so that is provided by regional and central institutions. Okay, regional and central institutes of the country. So now it's primary healthcare, the closest one, the PHCs and the sub-centers, then secondary more complex problems, district hospitals and CHCs, finally the regional and the central institutions and the tertiary. So from primary it's referred to secondary, from secondary it's referred to tertiary. That's what happens. Okay, now things are getting emerged. New goals are being set and new projects are being introduced. So where comes the concept of Millennium Development Goals, or you can call it as MDGs. So they can ask you goal 1 is what, goal 2 is what. Now see, this is outdated, but still if they ask you a repeat questions, this can come. Okay, so there's nothing outdated for NEET MDS. In Millennium Declaration, so what happened here is, in the Millennium Declaration, there was something known as a Millennium Declaration in 2000, year 2000. So all the goals were set till 2000, isn't it? So far we said the health for all phase and all. Now in 2000 they met to see that if all what we planned, is it executed or not. They realized that it is not executed. So at that time they said, we're going to declare new things. Okay, there is Millennium Declaration of September 2000. Okay, the date is important, 2000. Okay, by the member nations of United Nations. Now the countries increased, 189. Okay, there we studied that initially it was 134, isn't it? 134. So yeah. 134 countries initially. Now it's when it came to 2000, it became 189 countries. Okay, so currently how many countries are there? This is one thing which you need. 193 countries are there. Okay, 193 countries are there. Now see, there was a date set. They said, okay, 2000 we met. We have to set a date 2015 by which we have to achieve our goals. Okay, and the data was taken from 1990 and the goal has to be set by 2015. So you need data, isn't it? You can't say that, okay, what is there in 2000? No, from 1990, the progress till 2015 is what they looked for. Okay, so they set was 2015. So whatever the goals, it has to be attained by 2015. So when they met in 2015, they realized that, okay, they need more, that we will see. Okay, so date set was 2015. So this, see, the importance of this MDGs is that though the date is over, the same principles are being applied in recent developments. Okay, so the date set is 2015. Now, what's the goal 1? Eradicate poverty and hunger. Okay, the goal 1 should be, they realize that there is lots of poverty and hunger among people. So the goal 1 is poverty and hunger. Second is universal primary education. So the hunger is gone, give some education to the children. Okay, then promote gender equality and empower women. Very, very, very important. Okay, promote gender equality and empower women. Now see, in the current era, you won't understand the importance of this. There was a time where in the family, the woman was considered secondary. Even in high, what you call big societies, even in developed countries. Okay, you think that the UK, USA and all are, initially they adopted all these things. No, it was very, very sad. Okay, there's a big history. Okay, women were in USA, this is what happened. Women were given half the salary of men. Okay, unfortunately in our country also, we still follow some of which. Okay, not declared but undeclared following. Anyway, so it was not as you see here now. Okay, now people think gender equality means it's something, they define it in a different way. But actually, those days, it was pathetic. So gender equality and woman empowerment. So at that time, to get that gender equality, empowerment of women was very, very, very important. Okay, so now reduce child mortality. So then initially hunger, education to the children, then woman was given the same status in the family. Okay, now children was born, okay, in the family. So child death was considered, child mortality was a very important thing. And not just child, you should take care of the mother also. Okay, so hope you got, the family was considered, poverty was controlled. Then education in the family was given importance, and then woman was empowered, child was born, the child mortality, then woman, the mother has to be, mother is the key. So improve maternal health. Then they went into the society. They said, now all these personal problems we have solved. Now let us see, that is disease like HIV, AIDS, malaria and other diseases, big problem. So let's combat that. That's a goal 6. And finally, ensure environmental sustainability. Okay, you have done everything in the family, you have done everything controlling disease. If you are not sustaining with the environment, okay, the environment will destroy you, isn't it? Then develop a global partnership for all these things, for the development, overall development. It's not like one country goes its way, other country goes its way. No, all the countries together. That's what. Develop a global partnership for development. Okay, so let us go into a little bit of depth of it. The first goal is eradicate extreme poverty and hunger. Once again, so that was the first thing. And here, the underweight child below the age 5. This is very important. They can ask you a little tip. So underweight child below age 5 was given into consideration. Okay, below the age 5. So that's one. Now goal 2 is achieve universal primary education. The education was, you saw that. Then the third is promote gender equality and empower women, same thing. Reduce child mortality. Now this is very important here. Child mortality of what aspect? Under 5 mortality. So under 5 was initially given consideration. Under 5, age under 5. Okay, they can ask you the Millennium Development Goal, which of the following is truth. So they will not ask you any of these points. They will come directly to under 5 mortality rate. So you see that, okay, under 5, I've seen child mortality, not under 5. So it's under 5 mortality rate is also considered. Then infant mortality rate, but under 5 was given primary importance. Then proportion of a 1-year-old children who have been immunized against measles. The disease is important here. Okay, so 3 things here: under 5, infant, and immunization against measles. Which age group? Under 1 year. Okay, or 1-year-old children under or against the measles. That was to reduce what? Overall child mortality. Okay, so it is like 5, under 5, infant, and 1-year-old against measles. 3 things in the child mortality. Okay, then improve maternal health. That was 5th one. You saw. Then combat HIV, AIDS, malaria and other diseases. So what was the age group selected for this? HIV age group was selected was 15 to 25, age group between 15 and 24. Okay, so then ensure environmental sustainability and finally develop a global partnership. In the global development of global partnership, there was included access to essential drugs. Okay, that's one more thing you have to remember here. Access to the essential drugs was given priority. So once again, poverty, education. Poverty and education. Then woman was empowered, mortality was controlled. Okay, then once that is there, the mother's mortality, okay, maternal mortality, then coming into the society, HIV, AIDS and all those things, and finally you've got environmental sustainability. And now comes the next one, which is sustainable developmental goals. Okay, sustainable developmental goals. So Millennium Development Goals was end, okay, 2015. They said, okay, we didn't reach. So then in September 2015, that is 25th September 2015, so you have to study it in this order. Okay, in September 2015, they said we have to develop something known as Sustainable Developmental Goals. And the agenda was transforming our world. Okay, transforming our world, and by 2030, okay, the date set now was 2030, the 2030 agenda for sustainable development. Okay, to the 2030 agenda for sustainable development, and then it was 17 goals and 169 targets. So it's impractical to learn it. Okay, 17 goals and 169 targets were set, and then one specific goal. This is what you have to learn here. One specific goal was set for health. Out of 17 goals which was set and 169 targets which is set, one specific goal for health was considered. That was the third goal. So they can ask you like that. What's like in sustainable developmental goals, which goal is related to health? The third goal. And what's that goal basically? It is by 2030 end the epidemics of AIDS, tuberculosis, now very common diseases here, malaria, and neglected tropical diseases, and compact hepatitis, waterborne diseases, and other communicable diseases. Overall, it's controlling all the disease. Okay, three very important: AIDS, tuberculosis, malaria. Okay, then tropical diseases in general, definitely hepatitis and other diseases. Okay, so they can ask you of which AIDS, tuberculosis, malaria, and hepatitis. So learn this. Okay, so that is what you have to know here. So this is basically the Sustainable Development Goals, which is an outcome of the Millennium Development Goals to September 2015, transforming the world by 2030. The third goal was, so how many goals were there? They can ask you 17 goals and 169 targets are there. One specific goal for health, which is the third goal. And finally, you have got the combating the disease is what the goals were set. Okay.